options to our state-of-the-art facilities and excellent support staff. The Orthopedic Center of Palm Beach County is committed to providing you with the very best care. Call us at 561-967-6500 or find us at www.ocpbc.com. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. We're all human, and it's important to know that doctors are people too. Doctors have emotions, they have passions in life and hobbies, and they enjoy participating as active members in the communities where they practice medicine. Doctors have families, friends, and relationships. While the latest in healthcare and the most current treatments for ailments will be topics on this Doctors Are People Too radio TV show, the focus will be in learning more about the interesting aspects in a physician's life and what they do away from the doctor's office or operating room table.
Hello, South Florida and beyond, and welcome to Doctors Are People Too, and welcome on the iHeartRadio app, globally on the iHeartRadio app, and now on WWNN 95.3 FM and 1470 AM, and then also on the WWNN radio app. And as I'm doing it right now, technology is really moving. Just shared on Facebook Live to Tenet Florida Physician Services Facebook page, so I've never done that before, so got it just in time to start the program. So we are everywhere tonight. And I'm so excited to welcome to the program Dr. Joseph Ricotta, a vascular surgeon with Tenet Florida Physician Services. And then his office is Tenet Florida Cardiovascular Care, and we'll get a little bit into that in a little bit. He is Regional Medical Director for Vascular Surgery and Endovascular Therapies for Tenet Health's Florida region. So that's the whole region, Palm Beach, Miami-Dade, and Broward counties across South Florida. Dr. Ricotta, how are you doing tonight?
I'm great, David. How are you doing? Thanks for having me.
Thank you, and thank you for coming on Doctors Are People Too. I know you came straight from surgery. Where this broadcast is during the evening, but you were telling me as I was giving you directions, because you're not from this area, and we'll go into that a little bit, just came here from another region of the United States, but you came straight from surgery, and then you were telling me that, I've been in surgery since 7 a.m. today, and it was 6 p.m., and I was like, wow, I know surgeons, can sometimes be in for 10, 12 hours, but I didn't know that long. That is a really long time, so thank you for coming. Is that a normal day when you're when you're booked for surgeries?
It tends to be. Sometimes it's one big long surgery, and other times it's multiple surgeries one after the other. But today happened to be just a busy day.
Wow, so 11 hours.
Yeah.
Wow, unbelievable. And that's you do surgery at Delray Medical Center?
Yes.
Any other hospitals right now, or?
Right now, it's the practice is building at Delray.
Okay, Delray Medical Center. Just wanted to make sure, because I know things are fluid and they're always changing. And you actually came down here from the Atlanta area. Was your last professional practice on staff at?
I was in Atlanta for the last 7 years, working both at Emory Hospital, and then I was director of a Heart and Vascular Institute at Northside Hospital, which is a big hospital in Georgia. And before that, I was at the Mayo Clinic in Minnesota, and before that, the Cleveland Clinic in Ohio, and before that, I was at Johns Hopkins.
Wow, 3 prestigious institutions right back to back. The Mayo Clinic, Johns Hopkins, and Cleveland Clinic. You actually worked at all 3.
Yeah, that's right.
Unbelievable. I don't know if I've seen that before. I've been doing this show since May. I don't know if we've had the trifecta there of those fine institutions. So that's really neat. I want to get into a whole bunch of topics tonight, but let's talk a little bit about what, if you could tell us as much as you can tell us, what type of surgeries were you involved with just today?
Yeah, so today we did an aortic aneurysm repair. We were able to, instead of operate on the patient surgically like you would do traditionally, we were able to go in with a stent through a puncture in the groin and fix that aneurysm, what we call endovascular, inside the vessel. So we fixed it from the inside rather than to have to do surgery. So no incisions, just a needle puncture in the skin. And then had a very difficult case, which is what took me up till showtime here, which was a Patient came in with a long blockage in their leg artery, probably about 50 centimeters long of blocked artery, and no blood flow to the foot, and was at risk of having an amputation, and really was not healthy enough to have an operation. So again, we were able to go through with a little puncture in the skin and get through the blockages and sort of rotor-rooter out the blockage and balloon it open and put a stent in there and able to save her leg. So it took a little while to get through 50 centimeters long blockage, but we were able to get it done.
Wow, so that's 2 surgeries just today.
Yeah, and then
today.
there was one in between.
Oh, there's one in between too.
Which was
Wow.
another blockage in the leg artery. So.
And then last time we talked also, you were called into, was it a stroke protocol? A vascular surgeon will be called into those types
Sure.
of cases?
Yeah, so lots of times stroke is caused by blockages in the arteries that go up to the brain that are in your neck, called the carotid arteries.
Yep.
And when you have blockage in your carotid arteries, in your neck arteries, that can either decrease the blood flow to your brain and cause a stroke, or a little part of the plaque can break off and go into your brain and cause a stroke. And so as vascular surgeons, we fix those both sometimes with surgery, where we have to make a small incision in the neck and take out the blockage, or sometimes, again, endovascularly, where we can make a little puncture in the groin and go up and put a stent and open up the blockage. And so patients that come in with an acute stroke, we can go in and right away and fix it.
Because like we think of the word heart attack with heart, a stroke is actually, I've heard it termed a brain attack.
That's right.
So it's actually that
It's the
clot goes up
same-
into the brain?
Yeah, it's the same idea, where you're not getting enough blood flow to the heart. You have a heart attack, either because it's not enough perfusion, not enough blood's getting through there because the narrowing is so tight, or something breaks off of the plaque and goes and plugs up an artery. The same thing can happen to the carotid arteries in the brain.
Unbelievable. I did not know that before I talked to you last week about the vascular surgeon being called in, but it makes total sense with the carotid artery. Is that how I'm pronouncing
Carotid,
it?
yeah.
Carotid artery.
Yeah, you
Okay.
got it.
And we're kind of jumping all over the place. I'm really excited to have you here tonight. So let's go back to you. One of the procedures you did was for peripheral arterial disease,
Correct.
or the acronym is PAD,
Yes.
as we see it kind of online a lot. What is peripheral arterial disease?
Yeah, so peripheral arterial disease, which is commonly known, as you said, as PAD, is essentially blockages in the arteries in the legs. And what happens is, your legs, as you walk, your muscles need oxygen. Oxygen is carried in the blood. If there's a blockage in the artery in your legs, you're not getting enough blood down, you're not getting enough oxygen down, and you'll start to get pain in your legs when you walk. That's sort of the first symptom, is usually pain in the calves or in the thighs after you walk a little bit, and then you rest, the pain goes away, and you walk again, and the pain comes back. And that's called claudication. And peripheral arterial disease can start at claudication, and then the other side of the spectrum is, sores and ulcers and gangrene and things that could lead to amputation. So there's a big spectrum in peripheral arterial disease, but essentially it's blockage in the leg arteries that causes, poor circulation to your legs.
Now, is there a specific age range of the population that is affected by this ailment? Obviously, I'm kind of thinking it's for maybe the older population, or can it be for younger people as well?
Yeah, that's a great question. So about 12 million people in the United States have peripheral arterial disease, 12 million people.
Wow.
The risk factors, age is a risk factor just as we get older, usually age over 60, 65 years old. As we get older, the arteries develop plaque and things like that. But the biggest risk factors, quite honestly, is smoking. And it really only takes about 10, 20 packs of cigarettes to start doing the damage. So even if you were smoking when you were younger and you quit, you still may have done some damage. It's better than if you were still smoking, it's better that you quit, but it doesn't take a lot of cigarettes to do the damage. So smoking, number one, high blood pressure, high cholesterol, and then diabetes is a big risk factor for peripheral arterial disease.
Does obesity as well come into play with peripheral arterial disease?
So obesity itself doesn't cause PAD, but obesity can cause things like diabetes and high blood pressure and high cholesterol, which can lead to PAD.
Now, what can happen if it's left untreated? I think you kind of started to answer this. I think you said ulcers, or is even gangrene as well? Are those some
so
of the things that
the
can
natural
happen?
history of PAD would be, you'd start out with this claudication, so the pain in the legs when you walk. Untreated, if it gets worse, it'll you'll have pain in your legs at rest. So even not when you're walking, but even just sitting in a chair or lying in bed, you'll get pain in your legs and your feet. And then that would progress to having potentially open sores, ulcers, gangrene, and then, the end would be amputation of the leg.
And that's obviously something that you got to prevent, if you can.
Absolutely. Absolutely. So we're very aggressive about screening for PAD, about identifying people that are at high risk for developing PAD, examining them just with pulse exams, simple things like physical exam and pulse exams, but even things like an ultrasound, like they do in pregnant women.
Mm-hmm.
You can do an ultrasound of the leg in a vascular surgeon's office, where we can look inside the blood vessel with an ultrasound probe to see if there's any plaque there. And there's also some pressure testing. You put blood pressure cuffs on the legs and things like that. So those are the easiest way. It's very easy to screen for, and those are the easiest ways to do it. And obviously catching it early, eliminating the risk factors, treating it medically first, and then if it becomes refractory to medical treatment, then you can do things like open things up with balloons of stent or do bypass surgery. Nowadays we do very little bypass surgery because the technology for the endovascular approach is very advanced, and we can open up lots of blockages these days with balloons and stents and wires and catheters.
Now, the screening for the PAD and the ultrasound, that can actually be done in the office as someone sees you on a regular basis. They're one of your patients?
Absolutely. So very easy to do in the office. We have a full vascular laboratory in our office, so with any vascular disease, not only PAD, but any vascular disease, we can easily do ultrasound screening and test for PAD.
And I'm going to give out the info for your office. It's a new office with Tenet Florida Cardiovascular Care. I got to remember that. So I'm used to saying Tenet Florida Physician Services, and you're one of the doctors with Tenet Florida Physician Services, or TFPS. Dr. Ricotta's new office is located at 4205 West Atlantic Avenue, Building B, Suite 201. Right next door to here in Delray Beach. The number's 561-303-0013, and you can find them online at drjosephricotta.com. Just plug in there DR and then JOSEPH and Ricotta, RICOTTA.com, and you'll find his website there. I want to get into a few other topics, but it's hard to believe we're already at the first commercial break. So on the other side, we'll talk a little bit more about PAD, and then Marfan syndrome, and then a couple of other things that you have been doing actually as a pioneer in this county with the Magellan robotic system on Doctors Are People Too.
I make a dinner for me and my girlfriend. We ate, we enjoyed. The dinner was very good. She was ready to go to sleep. I said, okay, I'm going to stay on the couch a little bit to watch TV. I started to feel something in my throat, like I was choking. And all of a sudden, I feel the pain, the sharp pain, like somebody put a knife in your back and open and do like this. That was when I called my girlfriend. I said, you have to take me to the hospital. I couldn't die. When they were doing the test, they saw something was weird. My valve was ripped. I said, God, please help me to get out of this. Dr. Valle was on call. He was who performed my surgery. I described like an angel. I described like he was there to do that for me. My girlfriend, my son, he told me when they saw him getting out from the operation room, he was sweating. He was tired to be there for 10 hours. For me, it's unbelievable. I can walk, I can exercise a little bit, and I can drink red one, that light red one. Of course, 1 glass or 2 glasses. I see the life different. And I want to see my granddaughter to grow and my son to get old. So I wanna live. I think that God gave me one more chance in life. and I had to take advantage of this.
Tenet Florida Physician Services is a multi-specialty physician group providing care to the communities of Palm Beach, Broward, and Miami-Dade since 2007. The TFPS team is committed to delivering quality care. Our mission is to improve the quality of life of everyone who walks through our doors. Today, we are proud to be one of the largest and most respected physician networks in the area. To learn more about Tenet Florida Physician Services, visit tfpsdocs.com. That's tfpsdocs.com. Or to find a doctor, call 1-866-654-2362.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And we're back. Hello, South Florida and beyond. We're back on Doctors Are People Too. We're here with Dr. Joseph Ricotta, vascular surgeon and endovascular therapies is what he specializes in. He's regional medical director for vascular surgery and endovascular therapy at Tenet Health Florida Region. His office is with Tenet Florida Cardiovascular Care right here in Delray Beach. The number's 561-303-0013. or drjosephricotta.com. Dr. Ricotta, just before the break, we were still talking a little bit about peripheral arterial disease, and I wanted to ask you, I know you said it before, but how is this treated in the hospital setting? We just finished with a little bit about how it can be screened in the actual doctor's office, but you had one of these cases today. How is it in the hospital setting? How is it treated?
Yeah, so traditionally we've treated it with bypass surgery. So you make, cut in the leg and you bypass from above the blockage to the below the blockage, usually using the patient's vein or a piece of a graft. But over the last 10 or 15 years, the endovascular, revolution has taken place. And so the majority of these patients can now be treated minimally invasively with just a little puncture in the groin. And we can treat it from the inside rather than treat it from the outside. And with the endovascular techniques that we have now, I would say 95% of the patients I can treat successfully endovascularly. You can go endovascularly from the brain all the way down to the toe. So the patient that we had today was treated endovascularly. We were able to open up a 50-centimeter long blockage with wires and catheters and balloons and stents rather than to have the patient undergo, a 3 or 4 hour operation under general anesthesia. And a 2 or 3 hospital stay. The patient actually has already left the hospital, so 2 or 3 hours, and they're able to be discharged. And I know we're going to get into the robotics side of things, but especially when you have this endovascular robot that we'll talk about, that even widens the pool of patients that you can treat endovascularly from the inside through this minimally invasive approach.
So they're discharged from the hospital and they actually go home after this procedure?
Yep. So a few hours of bed rest to make sure that when we puncture the groin, there's no bruising or anything. And then about 3 hours after the procedure, they can go home.
And that's because it's so minimally invasive. Obviously, it's a shorter hospital stay, so there's less chance for infection.
Absolutely.
And,
with surgical bypass, they're in the hospital a minimum of 3 days, sometimes longer. Longer recovery time in terms of walking and getting back to your normal activities. With the patient today, they already have left the hospital and will be back to their normal activities tomorrow.
Unbelievable.
Yeah.
And then you were segueing into a little bit about the robot. I just want to let the listeners know, Dr. Joseph Ricotta, he was the first person in Palm Beach County, first hospital in Palm Beach County as well, to actually use the Magellan robotic system to navigate blood vessels for endovascular procedures. And that was done at Delray Medical Center about a month ago?
Yeah, November 2nd.
Oh, wow. It's already a little bit more than a month. Now, what is the Magellan robotic system, and what is unique about it?
So many people have heard of the Da Vinci robot, which is a surgical robot where you're controlling the instruments remotely at a workstation. There is now an endovascular robot. So it's a robot that, again, you can sit at a workstation and control remotely. the wires and catheters that are inside the patient's blood vessels. So you put the wires and catheters inside the patient's blood vessels, you sort of connect it to the robotic arm, and then you can manipulate from the workstation the wires and catheters. And I actually, when I was in Atlanta in 2014, did the first robotic case in the southeastern United States. And then, as you mentioned, about a month ago, we did the first case from Broward County up to the Florida-Georgia line. There's never been an endovascular robotic case ever done in Florida before. And the robot's called the Magellan robot. And what it enables you to do is precisely manipulate these wires and catheters. And so traditionally, you're manipulating the wires and catheters manually with your hands. And for the most part, we do pretty well with that. Mm-hmm. But there is some anatomy that makes it more difficult to navigate through, to get through big, long blockages, to get through really tortuous, meaning twisty, turny arteries, acute angulated arteries. The robot simplifies these complex procedures. It makes it much easier, makes it more precise. The movements are more precise. And sometimes when you're doing it manually, you can't do it. And so that patient either has to have open surgery, or they get converted, or they get converted to open surgery, or they can't be treated at all. And what the robot allows you to do is treat more patients successfully endovascularly, and it widens the pool of applicants that you can treat, through the minimally invasive endovascular technique. It's very precise. It keeps the wire and a catheter right in the center of the blood vessel. You don't have any touches of the walls and things like that you can have with the manual manipulation. The procedures are quicker, so they use less radiation for the patient, less IV dye, less contrast for the patient, and patient outcomes are better.
Mm-hmm. And less radiation for you as well, right?
Less radiation for the operator.
That's important because
no, absolutely.
You're doing, during your lifetime, probably thousands of these surgeries, and you have a wife and kids and family, and as well as your staff there in the hospital. Not as much radiation is obviously, more beneficial to
so
them.
Radiation safety is a big
Mm-hmm.
topic now, and it's invisible radiation, so you can't see it, and so people sometimes out of sight, out of mind. But it's very important, the hazards of radiation. Mm-hmm. And so anytime we can reduce radiation to the patient and to the operators and to the staff, it's better for everybody.
Awesome. Now, our listeners will remember a lot. You referenced the Da Vinci a few times, and our listeners will remember we've had a few surgical oncologists on the program who use the Da Vinci surgical system, general surgeons to do, I believe, laparoscopic procedures, very minimally invasive. And I actually attended a surgery when I worked on the hospital side that the Da Vinci was used as well. And I got to see it, and I was just fascinated that the physician was like 20 feet away from where the surgery was going on. But like you said, they were in a console. And a lot of people ask me if it looked like a video game console. I would say this, there's a screen and the doctors work in the controls, but if you remember the original Nintendos, there was a gyro thing with it, and it's more of like a gyro, and you're using your hands to manipulate the robot. Would that be a better way of than a video game console? Yeah,
no, absolutely. Mm-hmm. I mean, it's a little bit more sophisticated than just a video game console, but no, I mean, you're able to really be away from the radiation field, but really the most important thing is that the precision that it gives you in manipulating these wires and catheters. And the other thing I didn't mention is there's only 10 of these functioning robots right now in the world, of these Magellan endovascular robots, and so we have one now functioning at Delray Medical Center. After doing that first case a month ago, we've done about 4 or 5 more cases in the last 3 or 4 weeks.
Wow, you've really ramped it up. And if you'd like to learn more about this, I've seen it recently in the Palm Beach Post, an article on you. It's got a really nice picture, kind of explains it visually. You're sitting in the actual console, and the patient is, like I said, about 20 feet away. And then actually you were featured in the Sun Sentinel newspaper. I saw that last week as well. So people can just search Dr. Ricotta's name, and it should pop up there in the news feed on Google. Or you can check out tfpsdocs.com. We have it there, posted to Dr. Ricotta's website page as well, so you can check it out there. Now, how long is the recovery time from a robotic procedure like this?
Well, it depends on the procedure, But again, it's using the minimally invasive approach where we just put a little needle stick in the groin. And so most patients will go home the same day, just after a few hours. Some patients, depending on their medical comorbidities, may stay overnight and go home the next morning. But it's anywhere from a few hours to a quick overnight stay and go home in the morning. You have to compare that to open surgery, which is what's been done traditionally. And again, if you're talking about leg bypasses, it's at least 3 days in the hospital. If you're talking about open abdominal aortic aneurysms or thoracic aortic aneurysms, you're talking about up to a week or two in the hospital. A long time in the ICU. It's a much longer recovery, and it's probably about 3 months till you recover back to your normal lifestyle, 3 to 4 months. If you treat an aneurysm with stents just through a puncture in the groin with the robot, you're talking about probably going home the next morning and probably back to your normal recovery and lifestyle within 3 or 4 days versus 3 or 4 months.
I see. And then for a physician, is there a lengthy amount of training or hours you have to put on into a machine like this to learn how to do it properly? Yeah,
so there are some training modules and paradigms that you have to go through and get signed off or certified, if you will. And then you need to have your first few cases usually proctored by somebody that's an expert user. And then I would say the learning curve is probably somewhere around 15 to 20 cases. It's pretty intuitive, the system. So 15 to 20 cases, I think you can be, proficient in it. But there's a learning curve involved for sure.
About how many cases have you done with the Magellan?
Probably about 120.
Oh, wow.
Yeah.
And you started doing it in Atlanta or before that?
Started in Atlanta at the end of 2014. That was the first case in the Southeast.
Wow. Now, do you proctor other physicians for the Magellan now?
Yeah.
Okay.
So we teach, a lot of physicians will come from all over the world, actually, to watch these procedures, learn about it. And, we train them and try to, expand the operators that can use the robot.
Wow, that is fascinating. And that is the Magellan robotic system used to navigate blood vessels for endovascular procedures. First hospital in Palm Beach County to do it was Delray Medical Center. And, that is really, really something else. I want to get to Marfan syndrome again. I know we only have about 30 seconds to commercial break, so we may have to wait a second on that. But one of the things that the Magellan can be used to treat, and we'll talk about this on the other side, is aortic and peripheral aneurysms as well.
That's correct, yeah.
Okay, so let's go ahead and take our second break, and then on the other side we'll talk about Marfan syndrome, which is actually in the news right now, and always in the news, but it's a basketball player who's actually diagnosed with it, and aortic and peripheral aneurysms with Dr. Ricotta on Doctors Are People Too.
My dad is a cardiologist, and so I have two brothers, and we were all equally painful to my mom. And so to get us out of the hospital, we would go on rounds with him on Saturdays and Sundays in the hospital back in Oklahoma City. And we used to, race wheelchairs down the hallways from the time I was about 6 years old. When I was a freshman in high school, I got to watch my first heart transplant. But I think what really kind of made me want to be a doctor was around the holidays. The house always filled up with tons of gifts from thankful patients, and to impact people's lives like that in a positive manner was something that was very exciting to me. I'm very patient-oriented. I care about the patients both professionally and personally, and not only about their result, but also that I'm passionate about new technologies. I'm passionate about research, and I'm passionate about offering them the best technology available with the lowest risk and with the best outcome. What you want in a physician is someone who is personable, works as a team, embraces new technology, is clearly accomplished, but I think most importantly is somebody who you get confidence in. And the way I would have confidence is if I had a condition, I would read as much about it as I could before I showed up, probably off the internet, and then ask very directed questions. I do a lot of exercise. Running is what I use to kind of calm my brain down and kind of sort my thoughts out. So I enjoy, I just will put my shoes on and go for a run, and then I do mix in a little bit of yoga, something probably not many people know about me. I keep that on the down low, but so I do some yoga, and I go to the gym like most people.
Love Katie Cakes specializes in paleo, gluten-free, vegan, and regular sweets. Whether it's a cake, cookies, muffins, bites, or delicious treats, Love Katie Cakes is available for your special occasion. Katie DiPino is a certified pastry chef. Call her at 561-635-5831. It's Love Katie Cakes, LOVEKATIEKAKES @gmail.com, Facebook, and Instagram.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And we're back. Hello, South Florida and beyond. We're back on Doctors Are People Too. We're here with Dr. Joseph Ricotta. He's Regional Medical Director of Vascular Surgery and Endovascular Therapy for the Tenet Florida Heart and Vascular Network, Tenet Health Florida region. And also I wanted to get into a little bit about this. Newly named Professor of Surgery at the Charles E. Schmidt College of Medicine at Florida Atlantic University, FAU here in Boca Raton. Go Owls. I'm actually an FAU alumnus, so it's great to see that. So, Professor of Surgery, how does that come about? I mean, you just came down here. Was that something in the works for a little while now with their great medical school that they're building?
Well, they definitely have a great medical school, and yeah, I mean, so I've always been in academics my whole career, being from Johns Hopkins to the Cleveland Clinic to the Mayo Clinic to Emory, and always had a academic title and have been involved in teaching residents and medical students my whole career. And so, when I came down here from Atlanta, I definitely wanted to make sure that was going to be part of my job description, and was able to speak to the folks at FAU and the chairman of surgery there, Tom Genuit, who's a great guy. He's actually one of my former surgeons when I was at Johns Hopkins. He worked there, and so I actually was one of his residents. So it's good to be reunited with him. And I wanted to make sure that I was still going to be able to pursue my academic interests and teach the residents and the students and publish research papers and be involved in clinical research trials. So certainly the clinical side of things is very important to me, and it's a lot of what I do, but I also do a lot of cutting-edge research and writing papers and teaching the future physicians of tomorrow.
I always wondered how that works. Is a lot of your teaching and the educating that you do actually in the hospital, or is actually there on campus at FAU in one of the...
So the majority of it is clinical teaching.
Okay.
So, they are in the office with you seeing patients. They're in the hospital with you seeing patients. They're in the operating room with you, either observing or assisting. So a lot of it is on-the-job training, hands-on training on how to be a vascular surgeon, or for the medical students, how to be a doctor. But also I do give lots of didactic lectures, PowerPoint slide lectures on, the vascular disease, the vascular system, anatomy, things like that at the medical school as well.
So case studies as well?
Yeah, case studies.
Okay.
Absolutely.
Okay, and before the break, I've been trying to get to it twice, but I got a little tongue-tied there before the break. But one thing that is in the news right now is Marfan syndrome. I first heard about it 2 years ago. Actually, I watch a lot of basketball, and the center for Baylor, the Baylor Bears, Isaiah Austin, he was getting ready for the NBA draft. I think he was going to be a top 2 or 3 pick.
Yeah.
And all of a sudden, right before the draft, he was diagnosed with Marfan syndrome, and he was told he couldn't play. It was a little emotional for him. Obviously, his whole life he's wanted to play college and pro basketball. It's been his dream. So kind of a couple years went by, and all of a sudden it popped in the news that he's been okayed to return to basketball, and I believe he's going to enter the NBA draft this April. So his doctors cleared him. I guess over time that he was able to, they were able to study him and I guess make a decision that, he could, play again. But then I started doing research on it because the first time I didn't, and the farthest I got is that it's a syndrome of connective tissue in the body. But actually we have a vascular surgeon here, so I just wanted to ask you, what is Marfan syndrome, and is it more than just the syndrome with the connective tissue or disease of the connective tissue?
Yeah, so Marfan syndrome is one of many what we call connective tissue disorders. And it's probably the most prominent one. It's the most famous one. It's the one that everybody knows. But there's a whole spectrum of what we call connective tissue disorders. And what it is it's a genetic defect. So it's somebody that is born with a specific gene called the fibrillin 1, and it affects the connective tissue in the body. And what the connective tissue is in the body is it's a bunch of fibers, basically, that basically is the glue to all of your cells in your body. So there's fibers in your blood vessels, there's fibers in your bones, in your ligaments, in the lens of your eye, in your heart. So when you have a defect in these fibers, they lose their elasticity, Mm-hmm. So let's talk about the aorta for a second. So there's fibers in the aorta that when your heart beats, your blood pressure, the 120/80 blood pressure, right? So the 120 is the systolic, is the high number. That's when your heart's beating, that's the high pressure. And then when it refills, it's the low pressure, the 80. And the aorta will beat, and it expands and contracts with every heartbeat. And the way it can expand and contract is through these fibers that are in the wall of the aorta, and they make it elastic, so it expands and then it recoils and contracts. And what can happen in people with Marfan syndrome or with other people with connective tissue disorders is that their fibers, their connective tissue, stop becoming elastic, and they don't recoil back, and so they expand. They don't contract as well, and then they keep expanding, and they keep expanding. They get weaker and weaker, and the wall of the aorta, for example, will get weaker, and that's how aneurysms form. And so patients with Marfan syndrome and other patients with different connective tissue disorders can be predisposed to having aortic aneurysms, for example. The valves in your heart have those tissues in them, and you can have what was called mitral valve prolapse or valve defects in your heart. The eyes, the lens of your eyes, you can have dislocated lenses because it becomes very elastic and it doesn't go back into place. Your joints, they have, Marfan patients can have very hypermobile joints. So when they bend their fingers, they can be very flexible because, again, they lose that rigidity and they're very sort of elastic in their joints. And you can have joint deformities and scoliosis of the spine, for example. So the risk from a vascular standpoint for people with Marfan syndrome is that you can get dilation of your blood vessels. Your aorta is the most common, but also the other blood vessels in your body.
Okay, and then how did it come about? Is this something that can be cured or stabilized? Because why after like 2 years would he just all of a sudden be entering the NBA draft again? Is it something that doctors' care obviously helped out with him?
So I think that right now there's no cure for Marfan. I think there's a lot of research that's being done, and they're trying to figure out, gene therapy and those kind of things to try to actually get to it at the cellular level. And so it's a lot of monitoring and basically, not everybody with Marfan syndrome is going to have an aortic aneurysm, or not everybody with Marfan syndrome is going to have scoliosis of their spine. Or a mitral valve prolapse, but we monitor these patients closely, and if they develop them, we treat it right away. So with him, I know it's public, I think, that he has a visual problem in one of his eyes. He's actually blind in one of his eyes, and that's from the Marfan because the lens in his eye went a while back. And I think that he's been monitored by his physicians, and over the last 2 years has exercised and played basketball a little bit and worked out, and he hasn't had any growth in his aorta, and everything seems pretty stable. And so I think they're giving him a shot, and I'm sure he'll be very closely monitored regularly with EKGs and echoes and things like that to make sure that there's no dilation anywhere, because that's still a risk. I mean, he's not totally out of the woods. That still could develop over time.
I kind of put you out there on the plane because you're obviously he's not one of your patients, so you don't know exactly.
Yeah,
but you said a huge thing that you said there is that they're monitoring his aorta, so that's something that his physician probably would be. Would it be a vascular surgeon in this instance?
Could be a vascular surgeon or a cardiac surgeon. Yeah.
So they monitor the aorta and other...
Or a cardiologist, just usually with, echo, like ultrasound.
Oh, okay.
You can do echo ultrasound of the heart or of your aorta just to make sure that it's not growing or it's not dilated.
Now, is this something that's congenital? Are people born with this?
Yeah, so there's 1 in 5,000 people. 1 in 5,000 people will have this fibrillin gene defect, this Marfan gene. And if you have it, you have about a 50% chance to pass that on to your children. So 1 in 2. So yes, it's a genetic, what we call a genetic disorder or genetic pathology.
And your role in treating Marfan syndrome is with aortic and peripheral aneurysms, if it's to cause an aortic or peripheral aneurysm? That's
right. So again, if the wall of the blood vessels, the aorta or in any other artery, weakens because of the Marfan, you can get aneurysm formation. And the risk of aneurysms is rupture. You don't want them to burst. And so we try to monitor them very closely, catch them before, obviously, they get big enough where there's a high risk of bursting, and then we can fix them. And you can either fix them, sometimes in Marfan patients, they're young, and you might want to fix them with open surgery, and sometimes you can fix them with stents as well.
Now, if an aneurysm like that bursts, it causes internal bleeding. Is that the main thing it causes? Can it actually cause death as well?
Absolutely. So the big thing with aortic aneurysms in general is if you have an aortic aneurysm that ruptures, that bursts, you have about a 25% chance to live through that. So about 50% of people with a ruptured, burst aortic aneurysm will make it to the hospital alive. And of those 50%, about 50% would make it through surgery alive. So all comers, you have about a 25% chance to make it if your aneurysm bursts. And so we're very aggressive, again, about screening people with high risk factors for aneurysm. So Marfan syndrome is a genetic disorder where you can develop aneurysms, but garden variety aneurysms can be seen in patients that don't have Marfan syndrome, and those are usually people who smoke. And again, 100 cigarettes is all it takes to degrade the wall of the aorta. So people that smoke, people over the age of 65, white males are more at risk than females or non-Caucasian males, and then people with high blood pressure and high cholesterol. So those people can also develop aortic aneurysms. And so anybody over the age of 65 that's ever smoked should just get an ultrasound, a screening ultrasound, again, just like pregnant women do, to look and make sure that they don't have dilation or an aortic aneurysm. If you can catch them early, you can follow them. They don't all need to be fixed. They can follow them. And if they grow, then you can fix them before they cause a problem.
I've heard that you can actually monitor them. The physician can actually monitor them, and if at that time it's not the time to do a treatment or surgery, then you just monitor it over time. So that's actually good to know. So get in there and get, preventative care is one of the great things about our country, is that we have the option to seek preventative care if we'd like. We're here with Dr. Joseph Ricotta. His office is right here in Delray Beach. It's Tenet Florida Cardiovascular Care, 4205 West Atlantic Avenue, Building B, Suite 201, right here in Delray Beach. And a few of his colleagues, Dr. Bridge Manny there is interventional cardiologist, a structural heart cardiologist as well, regional medical director of transcatheter therapies for Tenet Florida, right there as well, and Dr. Brian Bethay, regional medical director of cardiac surgery at Tenet Florida as well. So Tenet Health Florida region, actually. So you got a trio of superstar heart and vascular physicians right there in Delray Beach. We're going to take our last break, and on the other side, I'm going to talk with Dr. Ricotta about venous seal that he actually does in the office, that can be done right there in the office to treat a whole variety of actually vein issues. You have a vein clinic there in Delray Beach. And then I got a couple curveball questions at the end for you on Doctors Are People Too.
Hi, my name is Dr. Rahul Agarwal. I'm an interventional cardiologist in Jupiter, Florida. I did my medical school at the University of Florida and my internship and residency at the same program. I did my chief residency also at Chance, and then did my cardiology and interventional cardiology at Wake Forest University in Winston-Salem, North Carolina. I specialize in general cardiology, interventional cardiology, and nuclear cardiology. Even though I'm an interventional cardiologist, the majority of my practice involves general cardiology. General cardiology is a pretty broad spectrum in that it involves rhythm problems such as atrial fibrillation, heart disease such as coronary disease, congenital heart disease, high blood pressure, and cholesterol problems. I do procedures such as cardioversions, which involve trying to convert the patient back to a normal rhythm if they have an arrhythmia. Also deal with plumbing problems such as the coronary arteries, which if they're blocked, I can do angioplasty and stents, which involves balloons that open up the arteries. And these stents act as scaffolds that keep these arteries open. I really do believe in preventive medicine, and one of the areas that I really focus on is diet. One can really get caught up on the pills aspect and the exercise. And diet we talk about a lot, but unless one really has some guidance as to where to go with diet, it can be quite difficult. So I do give my patients homework in terms of books or movies that they can rent or obtain so that they can get educated. Our cardiology office is located in the Abacoa area of Jupiter, Florida, conveniently located between two of the local hospitals. We provide echocardiography, stress testing, ultra monitoring, and general cardiology office visits. We really pride our practice in its staff, who are very courteous and professional. We believe that under our care, you'll feel the same way too.
Tenet Florida Physician Services is a multi-specialty physician group providing care to the communities of Palm Beach, Broward, and Miami-Dade since 2007. The TFPS team is committed to delivering quality care. Our mission is to improve the quality of life of everyone who walks through our doors. Today, we are proud to be one of the largest and most respected physician networks in the area. To learn more about Tenet Florida Physician Services, visit tfpsdocs.com. That's tfpsdocs.com. Or to find a doctor, call 1-866-654-2362.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
Welcome back to Doctors Are People Too. We're here with Dr. Joseph Ricotta. We're in our last segment. So, like the read said, if you do have a question, the number is 1-888-565-1470. You can call in and ask Dr. Ricotta about anything to do with vascular and endovascular therapies, vascular surgery. We talked a little bit about the Magellan robotic system. We talked about Marfan syndrome. We talked a lot about peripheral arterial disease. And right now I want to get into some of the things you do offer in the office besides screenings and, regular vascular care. Now, the VenaSeal is a closure system that is used to close, I want to put this in the right way, but close veins or arteries that are leaky. So what is the VenaSeal closure system, Dr. Ricotta?
Yeah, so it's used on the veins, not the arteries. Veins. You're right. And it's used to treat something called venous insufficiency. And what that means is the veins take the blood, so the arteries take the blood from the heart to the feet, and the veins take the blood back from the feet to the heart. And it's supposed to be a one-way system from the feet to the heart. And the veins have little valves in them that as the blood goes through, the valves will close and keep it a one-way system up, sort of like a check flow valve. Over time, as we get older, women who have been pregnant before usually are predisposed to this because the pregnant uterus puts pressure on the veins. people that have jobs that stand for a long time, gravity works against the veins. People that are a little overweight, and then family history, people that have family members who have varicose veins, bulging veins, vein problems. Those are the people that are predisposed to having these leaky valves. And what happens is the blood goes up and the valves don't close very well, and they leak, and the blood leaks back through the wrong way and pools down in your legs and in your feet. And what that can give you is bulging veins, spider veins, bulging veins meaning varicose veins, spider veins, legs swelling, a feeling of heaviness or tiredness of your legs, like they're weighted down, burning or itching of your legs. Even restless leg syndrome can be caused by this leaky valves in the veins or venous insufficiency. So the old way, or the traditional way to treat it, is to do what's called vein stripping. And that actually is sort of a barbaric surgery where under general anesthesia you make a cut in the leg and you take the bad vein and you basically pull it out of the body. And the patients have to stay overnight, usually a night or two in the hospital. There's a lot of bruising and pain associated with it. So we evolved, fortunately, from that, just like a lot of things in vascular surgery, which have evolved from surgery to the endovascular approach, treating it from the inside. And then we had what's called endovenous ablation of the vein, where you could fix it in the office instead of the operating room under just local anesthesia. And you go in with a catheter and you basically heat the vein closed. So instead of taking the vein out of the body, you can leave it in the body, but you close it down with heat, with a catheter and heat. And functionally, it's the same thing as taking it out of the body, but it's a lot easier for the patient. VenaSeal is even a better technology, and that was introduced about a year ago. And when I was in Atlanta, I actually did the first case in the southeastern United States last December. And we did the first case in South Florida about 6 weeks ago or so here at Delray at our office. And this is a way where you go in with a catheter, but instead of heating the vein, you inject this polymer. This VenaSeal is an adhesive polymer, sort of like a super glue, and you basically super glue the vein shut instead of heating it shut. Well, what are the advantages of that? When you heat the vein shut, both procedures are easier than going to the dentist. So it all can be done in the office, a little lidocaine, simple to do as opposed to vein stripping. But when you heat the vein shut, you have to give several numbing injections so that the patient doesn't feel the heat. There's a little bit of inflammation from the heat. Afterwards, the patient has to wear a wrap and then compression stockings up to their thigh for 2 weeks, and they can't exercise for 2 weeks. And usually you do one vein at a time. With the VenaSeal, the super glue, the VenaSeal, no injections because we're not heating the vein up. Very little irritation or inflammation because we're not heating the vein up. But more importantly, no wraps, no stockings at all, just a Band-Aid. And you walk out of the office and you can exercise the same day. You can go running, you can go play golf, you can go play tennis, and you can treat all the veins at once. So it really is a revolutionary new treatment. And again, we were the first ones to do it in the area, and it's done in the office.
Unbelievable, done right in the office. And I actually heard a woman talking about it that had it done. She had correct me if I'm wrong, the venous reflux disease so bad that it was actually, her legs were bleeding, like would bleed at night. Actually, from the skin.
That's right, because sometimes you can have such high pressure from the blood pooling back the wrong way that the bulging veins could pop, they could burst, and you can bleed from it. So she had the VenaSeal procedure, and she said that before she left the office, her symptoms went away before she even walked out of our office right after the procedure. So it's pretty impressive to see that, yeah.
And that you actually use thermal energy in the office to see the veins? Right there in the office, you push against the...
We do it, we see the veins under ultrasound. Using ultrasound,
okay.
And then the thermal energy is either using that catheter that does the heat closure, or we can use a catheter that injects the VenaSeal polymer. So we do both. And, some patients want to have the heat instead of the VenaSeal, but really the VenaSeal is the way of the future.
Okay, we have a couple more minutes. I just have a couple questions that I definitely wanted to get to. When you're not doing procedures with the Magellan robotic system, when you're not doing the VenaSeal, treating Marfan syndrome, aortic and peripheral aneurysms, I could go on and on with your areas of interest. It's quite impressive. what do you do outside to get away from, a day of like 11 hours of surgery? What are your hobbies and passions in life?
Sure, yeah. So I have a wife and 3 young children. So any time I get to spend with them is a blessing, and I try to spend as much time with the kids as possible. I played basketball and football at Yale, so I love sports, love playing sports, love watching sports, and I coach all 3 of my kids' sports teams, basketball teams. So most of our outside activities are revolving around either playing, coaching, or watching some kind of sporting event.
Do you have a favorite sport to coach, or you just like being out there with
basketball.
the kids? Basketball.
Probably basketball, yeah. I coach my 13-year-old son, 10-year-old daughter, and 8-year-old son.
Oh, wow, all 3 play.
Yeah.
Unbelievable. Yeah. Now, do you have a favorite basketball team, pro, college? Obviously, Yale.
So the Yale Bulldogs, which
Yale
actually
Bulldogs.
they did okay in the NCAA tournament. They lost to Duke in the second round, so they beat Baylor, actually.
Nice.
I think just being in Atlanta the last 7 years, we sort of become Atlanta Hawks fans, but now I'm looking forward to going to some Miami Heat games and becoming a Heat fan.
Yeah, we'll have to we'll get them playing again here. We had quite a run the last few years, and then we're kind of getting, I guess, paid back for our run.
Well, they're rebuilding now with the young kids. Yeah.
They are rebuilding, definitely. Now, let me ask you a surprising thing about you. I heard that you listen to old school hip hop in the operating room.
Yeah, that's right.
When you can.
I do. It just it sort of gets me motivated when I'm doing surgery. There's different parts of surgery where sometimes you need to be quiet, and sometimes you need to have your adrenaline going. So probably something that most people don't know about me is I like to listen to old school hip hop. It just sort of gets the juices flowing and helps me operate better, I think.
Well, that's great. Well, thanks again for coming on Doctors Are People Too. It's hard to believe that we've went through a whole hour, but I think we touched on a lot of subjects, and I'd like to have you on the program again next year if you're interested.
Absolutely. I'd love that. Thanks for having me.
Thank you. And that's Dr. Joseph Ricotta, drjosephricotta.com, 561-303-0013, with an office in Delray Beach.
Thank you for listening and watching Doctors Are People Too with David DiPino. Join us next week for more in-depth views on what doctors are all about and how they spend their free time. All shows can be seen on amp2.tv. And if you have questions you want answered on the air, call 866-224-5422 and leave a message that can be read on the air. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and